Welcome back to our interview with Dr. Kenneth Iserson, author of Getting into a Residency, a guide for medical students, now in its 8th edition. Dr. Iserson, what factors should medical students consider when choosing a specialty?
Jen, once you've decided on some specialties in which you might be interested, you have to think about some other factors. One is, how long is the training? Understanding that the length of the training doesn't necessarily equal extra income in the future. Another is, how available will jobs be in that specialty? Now, physicians will always have jobs, but if you're training in a certain specialty or subspecialty, you want to know that you'll be able to work in that area. And finally, maybe most important, how difficult is it to get a residency position in that specialty? When you're assessing that, you need to honestly assess how competitive are you.
There are many factors that go into selecting a specialty. Are there some that people don't like to talk about?
Jen, there are two factors that medical students often consider when selecting a specialty. The first is monetary rewards, which is not unusual since most medical students graduate with enormous debts. The problem in using this as a consideration is that it doesn't enter into how happy you're going to be during your entire career. And take it from someone who's been around the block for many decades in medicine, you want to be happy to go to work. The second is work hours and lifestyle. Specialties with controllable lifestyle are now oftentimes much more popular than those where the physicians are working day in and day out. But that's a personal decision.
How can students find out more about individual specialties?
Aside from the description of every specialty and subspecialty in my book, you can get online information. And the book actually has URLs that you can go to for some of this information. But reading can only get you part of the way. You want to visit some local or national meetings of the specialties in which you're interested. Read some of their what are called throwaway publications or newsletters that have really nitty-gritty information about what's happening in the specialty, not just the science. And then spend some time locally or, if you have to, somewhere else with clinicians in that specialty. Just call them up, ask them if you can spend some time in their offices or rounding with them in the hospital. They'll be almost invariably going to say yes because you're a member of the fraternity now. And they're very impressed that you're interested in what they've spent their life doing.
Dr. Iserson, are there some final tips you can give students about selecting a specialty?
Your specialty choice is the most important career decision you'll make. It's going to determine whether you enjoy your medical practice throughout your career. And be assured that both you and your patients will appreciate your taking the time to choose carefully and wisely.